All India Radio presents Morning News. Good morning. I'm Anuja Kumar and with me is Saira Mujtaba. The headlines. Prime Minister Narendra Modi to chair high-level meetings today to review prevailing COVID-19 situation. To interact with Chief Ministers of high-burden states also. Finance Minister Nirmala Sitharaman asks insurance regulator IRDAI to ensure timely authorization for cashless treatment of COVID patients. Uttar Pradesh government to invoke National Security Act against those responsible for black marketing and hoarding of necessary medicines and oxygen. Over 13 crore 53 lakh COVID-19 vaccine doses administered in the country so far. Election Commission bans road shows, padyatras and vehicle rallies in West Bengal. Registration for annual Amarnath Yatra suspended temporarily amid rising COVID cases in the country. Prime Minister Narendra Modi announces India-US partnership on clean energy and climate change. India women boxers clinch 7 gold medals in World Youth Boxing Championships in Poland. And Royal Challengers Bangalore registers thumping 10-wicket win over Rajasthan Royals in IPL cricket. As the number of COVID cases is on the rise again, we appeal to our listeners not to lower their guard, take all the precautions, and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi will chair high-level meetings today to review the prevailing COVID-19 situation. Due to this, he has cancelled his visit to West Bengal. In the morning, the Prime Minister will review the COVID-19 related situation in an internal meeting. He is also scheduled to interact with Chief Ministers of high-burden states on the COVID-19 situation. In the afternoon, the Prime Minister will hold a meeting with leading oxygen manufacturers in the country through video conferencing. In the evening, Mr. Modi will address the voters of Birbhum, Kolkata, Malda and Murshidabad virtually. Prime Minister Narendra Modi has directed officials to ensure that oxygen supply to various states happen in a smooth and unhindered manner. Chairing a high-level meeting yesterday to review the oxygen supply across the country and discuss ways and means to boost its availability, Mr. Modi spoke about the need to fix responsibility with the local administration in cases of obstruction. He also asked the ministries to explore various innovative ways to increase the production and supply of oxygen. The Prime Minister stressed on the need to ensure faster transportation of oxygen to the states. He also stressed that the states should come down heavily on hoarding. The Prime Minister was briefed on how oxygen supply to states is steadily increasing. Against the present demand from 20 states of 6,785 metric tons per day of liquid medical oxygen, the Government of India since yesterday has started allocating 6,822 metric tons per day to the states.
The Centre has directed states and union territories to ensure that there should be no restriction imposed on the movement of medical oxygen between the states, and transport authorities shall be instructed to allow free interstate movement of oxygen-carrying vehicles. Union Home Secretary and Chairman of National Executive Committee, Ajay Kumar Bhalla, has written a letter to Secretaries of Ministries and all the Chief Secretaries and Administrators of states and union territories in this regard. Mr. Bhalla also directed to ensure that no authority shall attach the oxygen-carrying vehicles passing through the district or areas for making supplies specific to any particular district or area. Finance Minister Nirmala Sitharaman has said that the government is working hard for better coordination between states, hospitals and suppliers of oxygen and vaccines to match the demand and supply in the country. Addressing a virtual event organized by PHDCCI in New Delhi, Mrs. Sitharaman said the Prime Minister himself is monitoring the situation with eminent doctors and vaccine manufacturers. She said the import of vaccines certified by international bodies has been allowed in India. Ms. Sitharaman said a slew of announcements have been made in regard to the drug remdesivir and custom duty has been waived off. She said these announcements are expected to increase the availability of the injection in the country.
Finance Minister Nirmala Sitharaman has asked insurance regulator IRDAI to ensure timely authorization for cashless treatment of COVID patients. Ms. Sitharaman spoke to IRDAI Chairman S.C. Khotia over the reports that some hospitals are denying cashless insurance. In a tweet, she said, in March last year, COVID was included as a part of comprehensive health insurance, and cashless service is available at networked or even temporary hospitals. The minister informed that over 9 lakh COVID-related claims have been settled by the insurance companies for 8,642 crore rupees so far. She added that even teleconsultations can be covered in it. The minister said that IRDAI will direct companies to prioritize authorizations and settlements of COVID cases. India has administered over 13 crore 53 lakh COVID-19 vaccine doses in the country so far. These include over 92 lakh healthcare workers who have taken the first dose and more than 59 lakh healthcare workers who have taken the second dose. Over 1 crore 17 lakh frontline workers have taken the first dose and more than 60 lakh frontline workers have taken the second dose. The Union Health Ministry said that more than 30 lakh 16,000 beneficiaries were inoculated with COVID-19 vaccine doses till 8 p.m. yesterday, out of which over 18 lakh beneficiaries were vaccinated for first dose and more than 11 lakh beneficiaries received the second dose of the vaccine.
The registration process for COVID vaccination to all above 18 years will start from the 28th of this month. All those eligible can register on CoWIN portal, cowin.gov.in. The third phase of COVID vaccination is starting from 1st of next month. The Health Ministry has said CoWIN portal will be made ready for 18-plus beneficiaries by 24th of April. In this phase, vaccination will continue as before in Government of India vaccination centres free of cost to the eligible people, including healthcare workers, frontline workers and all above 45 years of age. During this phase, vaccine manufacturers will supply 50% of their monthly released doses to the central government, and they will be free to supply the remaining 50% doses to states as well as in the open market. The Health Ministry has issued a revised clinical guidance for management of adult COVID-19 patients. The guidelines issued by AIIMS ICMR COVID-19 National Task Force and the Joint Monitoring Group DGHS under the Ministry said, under emergency use authorization, remdesivir may be considered for only those patients with moderate to severe diseases requiring supplemental oxygen within 10 days of onset of symptoms. It said remdesivir is not recommended for those with severe renal impairment or hepatic dysfunction. It said remdesivir is not to be used in patients who are not on oxygen support or in home settings. The guidelines recommended emergency use authorization or off-label use of tocilizumab drug in case of severe diseases, preferably within 24 to 48 hours of the onset of the disease or ICU admission. It said tocilizumab may be considered in patients with significantly raised inflammatory markers and not improving despite use of steroids, with there being no active bacterial or fungal or tubercular infection.
The Health Ministry has said a record number of over 3,14,000 fresh cases were reported in the country within 24 hours. This is the highest number of new cases registered in a single day since the outbreak of the pandemic in the country. With this, the cumulative positive cases crossed the 1 crore 59 lakh mark. The ministry has said at present there are over 22,91,000 active cases in the country, which comprises 14.38% of the total positive cases. The recovery rate stands at 84.45%. A total of 2,104 deaths were reported in the country in the last 24 hours, taking the toll to over 1,84,000 across the country. Delhi registered 26,169 new COVID-19 cases and 306 related deaths in the past 24 hours. This was the highest number of COVID-19 deaths the national capital has registered in a single day. As of now, there are 91,618 active COVID-19 cases in the city, while the death toll has mounted to 13,193. So far, 9,56,348 people have been infected with the virus in the national capital since the start of the pandemic. Also, 53,673 doses of the COVID-19 vaccine were administered in Delhi in the last 24 hours.
The Uttar Pradesh government has said that it will invoke National Security Act and Gangster Act on those people who are involved in black marketing and hoarding of necessary medicines, oxygen and injections required for COVID treatment. Chief Minister Yogi Adityanath assured that there is no dearth of oxygen for patients in the state and the government is doing its best to provide oxygen to all hospitals. After a review meeting yesterday, the Chief Minister said that very soon the state will get 1.25 lakh doses of remdesivir injection. He directed officials to double the number of COVID beds in each and every district of the state. On the other hand, positive news is also coming in from the state capital, Lucknow, which had been the epicenter of the pandemic since the last few weeks. Yesterday, after a long time, the number of recovered patients was higher than the number of new infected patients in the city. 6,207 people recovered from coronavirus, while around 5,239 people got infected from this virus in the last 24 hours. Lucknow currently has more than 50,000 active COVID patients. The Bihar government has decided to set up 100 to 500 bed COVID care centers in every district of the state in view of the increasing number of COVID-19 cases in the state. These centers will be equipped with oxygen facility. Principal Secretary of Health Department Pratyay Amrit said cryogenic oxygen tank will be established in every district to meet challenges of oxygen scarcity. The state government has also decided to buy 100 TrueNet machines to enhance testing facilities. Meanwhile, 11,489 fresh cases of COVID-19 were reported in the state yesterday. 91 deaths were also reported.
In Chhattisgarh, State Board of Secondary Education has cancelled the examinations of Class 10th. The exams for Class 12th have been postponed for the time being in view of the prevailing pandemic situation. More from our Raipur correspondent.
Chhattisgarh Board of Secondary Education has postponed the examinations of Class 12 to be held from 3rd May. The new timetable will be released once the situation of the COVID pandemic improves. While cancelling the examination of Class 10, the board has issued guidelines that the students of Class 10 will be awarded marks based on the assignments issued by the board. If a student has not done the assignment, he will be awarded the minimum marks required to pass. Meanwhile, the Higher Education Department of Chhattisgarh has issued an order that no examination in the government and private universities will be conducted in offline mode during current academic session. All exams will be online. Vikalp Shukla, AIR News, Raipur.
Madhya Pradesh Chief Minister Shivraj Singh Chauhan has said that action should be taken against the black marketers of remdesivir injection under National Security Act. He said action should also be taken against those who spread rumors and give misleading information regarding oxygen supply. More from our Bhopal correspondent.
In a high-level meeting to review COVID control situation in the state, Chief Minister Shivraj Singh Chauhan has said that the way the public has come forward for the corona curfew and everyone has cooperated, it has reduced the speed of spreading the infection. Chief Minister informed that continuous talks are going on at the central government level, including DRDO for oxygen supply. Every possible support is being provided by the central government in the supply of oxygen. Vaccination is being given momentum in the state from May 1st. All people over the age of 18 will get free vaccination. Pooja Pivardhan, AIR News, Bhopal.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi to chair high-level meetings today to review prevailing COVID-19 situation, to interact with chief ministers of high-burden states also. Finance Minister Nirmala Sitharaman asks insurance regulator IRDAI to ensure timely authorization for cashless treatment of COVID patients. Uttar Pradesh government to invoke National Security Act against those responsible for black marketing and hoarding of necessary medicines and oxygen. Over 13 crore 53 lakh COVID-19 vaccine doses administered in the country so far. Election Commission bans road shows, Yatras and vehicle rallies in West Bengal. Registration for annual Amarnath Yatra suspended temporarily amid rising COVID cases in the country. Prime Minister Narendra Modi announces India-US partnership on clean energy and climate change. Indian women boxers clinched 7 gold medals in World Youth Boxing Championships in Poland. And Royal Challengers Bangalore registers thumping 10-wicket win over Rajasthan Royals in IPL cricket. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
The Election Commission has prohibited any roadshow, Padyatra, cycle, bike, vehicle rally in West Bengal in light of non-adherence to the COVID protocols by many political parties. In an order issued yesterday, the central poll body said that public meetings beyond the limit of 500 persons will not be allowed in the state. The new provisions will be in place till the conclusion of the polls. Taking strong cognizance of the non-adherence of COVID protocols during campaigning by several political parties, the Commission issued the order. The Election Commission reiterated its direction to all the political parties to strictly adhere to the COVID protocols in all the future rallies in the state, which would be held with maximum 500 people. In Maharashtra, 13 patients lost their lives in a fire at a private Covet hospital in Virar near Mumbai this morning. Fire was reported at around 3 a.m. in the ICU ward of the hospital. The fire brigade doused the fire. The hospital is situated in Palghar district.
The Orissa government has imposed 14-day quarantine for people coming to the state from West Bengal. An order to this effect was issued yesterday, particularly in view of the detection of the triple mutant variety of COVID-19 virus in West Bengal and other states. We have more details from our Bhubaneswar correspondent.
Whatever be the mode of travel from West Bengal to Odisha, one has to undergo 14 days institutional or paid quarantine in centers identified by the local authority. However, on the production of second dose vaccination certificate or RT-PCR negative report within 48 hours of entry into the state, one can have the liberty of home quarantine, that too for 14 days as usual. No one entering Odisha from West Bengal would even be allowed to disembark anywhere inside the state if one is en route to other states through Odisha. Meanwhile, COVID-19 active caseload of the state has further shot off beyond 35,000 with a detection of 6,000 new cases during the last 24 hours. Girish Chandra Das, AIR News.
Tamil Nadu logged more than 12,600 new COVID cases yesterday. The state government has said it has sufficient stock of RT-PCR kits and medical oxygen in its hospitals. In a statement, Chief Secretary Rajiv Ranjan said, out of the nearly 55,000 beds in government hospitals meant for COVID treatment, more than 65% have been connected with high-flow oxygen cannulas. About 240 tons of liquid oxygen are being used in the state every day. More from our Chennai correspondent.
The Tamil Nadu government has unveiled a plan to conduct vaccination camps in most workplaces from the 1st May, once the youth over the age of 18 also become eligible to take it. The state administration has said the camps will be held for all kinds of workers, including migrant laborers, construction workers, retail traders, teachers and government staff. In response to reports of wastage of vaccination doses, the state administration has clarified that wastage will come down in the coming days. Jai Singh, AIR News, Chennai.
The Ministry of Civil Aviation and the Directorate General of Civil Aviation have granted conditional exemption to Indian Council of Medical Research for conducting feasibility study of COVID-19 vaccine delivery using drones in collaboration with IIT Kanpur. The exemption is valid for a period of 1 year or until further orders. The Ministry of Civil Aviation said these exemptions will be valid only if all conditions and limitations for the entities are strictly adhered to. In case of violation of any condition, the exemption shall become null and void, and action may be initiated by Ministry of Civil Aviation and Directorate General of Civil Aviation. In view of rising corona cases in the country, Sri Amarnath Ji Shrine Board has temporarily suspended the registration for this year's Yatra to the Amarnath Cave Shrine. In a tweet, the Shrine Board said the COVID situation is being constantly monitored and registration will be reopened once the situation improves. The 56th-day annual Amarnath Yatra will commence on 28th of June and continue till 22nd of August. The online registration for the Yatra began on the 1st of April, which now stands suspended.
Musician Shravan Rathore of Nadeem Shravan Duo passed away yesterday evening due to COVID-19. After testing positive for COVID-19, 66-year-old musician was admitted to a private hospital in Mumbai. Aashiqi, Sajan, Hum Hai Rahi Pyar Ke, Pardesh, Raja Hindustani are some of their popular hits. Nadeem Shravan duo had done the hat-trick of winning Filmfare Awards for Best Musician.
Prime Minister Narendra Modi has announced US-India partnership on clean energy and climate change. Addressing Leaders Climate Summit, Mr. Modi announced launch of India-US Climate and Clean Energy Agenda 2030 partnership, which can be a template of green collaborations to help developing countries access to affordable green finance and clean technologies.
As a climate-responsible developing country, India welcomes partners to create templates of sustainable development in India. This can also help other developing countries who need affordable access to green finance and clean technologies. That is why President Biden and I are launching the India-US Climate and Clean Energy Agenda 2030 partnership. Together, we will help mobilize investments, demonstrate clean technologies, and enable green collaborations.
Underlining that the concrete action is needed for humanity to combat climate change, he said, "We need such action at a high speed, on a large scale, and with a global scope."
Concrete action is needed. We need such action at a high speed, on a large scale, and with a global scope. We in India are doing our part. Our ambitious renewable energy target of 450 gigawatts by 2030 shows our commitment. Despite our development challenges, we have taken many bold steps on clean energy, energy efficiency, afforestation, and biodiversity.
The summit called by US President Joe Biden, several countries including the US, Japan and Canada announced their enhanced climate action plans to substantially cut their carbon footprints by 2030. Aim of the Leaders Summit is to galvanize efforts by the major economies to reduce greenhouse gas emission and meet the targets of the Paris Agreement to keep temperature rise to well below 2 degrees Celsius above pre-industrial levels by the end of the century. United States will boost public climate finance to help poor countries reduce greenhouse gas emissions and adapt to a changing climate. White House said it is embracing ambitious but attainable goals for international aid to developing countries, given the urgency of the climate crisis and to compensate for a sharp drop in U.S. funding during the Trump administration. It added that by 2024, it will triple financing of climate adaptation, which focuses on adjustments to current or expected climate change. The U.S. administration released its climate finance plan in tandem with a new goal to cut emissions by 50% to 52% from 2005 levels. The U.S. International Development Finance Corporation will also change its development strategy to include climate for the first time and prioritize climate mitigation and adaptation. Defence Minister Rajnath Singh has spoken to his Indonesian counterpart General Prabowo Subianto on the phone and shared his pain over the news of missing submarine Nagala, its crew members. In a tweet, Mr. Singh said, India is extending its full support to the ongoing Indonesian rescue efforts. The Defence Minister said he has already directed the Indian Navy to move its Deep Submergence Rescue Vessel, DSRV, to Indonesia and also tasked the Indian Air Force to see the feasibility of induction of the DSRV intervention system by air.
In the World Youth Boxing Championships, Indian women boxers put up sensational performances as they created history with 7 gold medals in Kielce in Poland. All women finalists, Geetika, Naurem Bebirojasana, Chanu, Poonam Vinika, Arundhati Chaudhary, T. Shanamacha Chanu and Alfia Pathan registered their wins and finished on top of the podium. Apart from the 8 finalists, 3 others won bronze medals at the tournament. We have more details from our correspondent.
In IPL cricket, Devdutt Padikal's unbeaten 101 and skipper Virat Kohli's 72 not out helped Royal Challengers Bangalore registered a thumping 10-wicket win over Rajasthan Royals in Mumbai last night. Devdutt Padikal was declared the player of the match. Chasing 178, Padikkal and Kohli displayed an amazing show with the bat as both the openers took RCB across the line in 16.3 overs. Earlier, Shivam Dube and Rahul Tewatia played knocks of 46 and 40 runs respectively to steer Rajasthan Royals to 177 by 9 in their allotted 20 overs. Today, Punjab Kings will take on Mumbai Indians at M.A. Chidambaram Stadium in Chennai. The match will start at 7:30 p.m. In tennis, the world number 1 Novak Djokovic beat Kwon Soon Woo in straight sets 6-1, 6-3 in his first match at the Serbia Open in his hometown of Belgrade. Djokovic will now face compatriot Miomir Kecmanovic in the quarterfinals of the ATP 250 tournament, which was reinstituted this year after a pause of 8 years. World number 10 Matteo Berrettini also reached last 8 by beating Marco Cecchinato. In the Barcelona Open, Rafael Nadal has reached his 14th career quarterfinal after conquering Japanese Kei Nishikori. Nadal will face Brit Cameron Norrie in the quarterfinals. Sports Desk, AIR News.
Now let us take a look at the weather forecast for today. Srinagar will have partly cloudy sky. Temperature will hover between 8 and 17 degrees Celsius. Jammu will have a partly cloudy sky with 1 or 2 spells of rain. The minimum temperature was 16 degrees Celsius, while the maximum will be around 27 degrees. Leh will witness light snow. Minimum and maximum temperature will hover between -4 and 6 degrees Celsius. Gilgit will have generally cloudy sky with light rain. The temperature will hover between 10 and 25 degrees Celsius. Muzaffarabad is likely to have mainly clear sky becoming partly cloudy towards the evening. The minimum temperature was 11 degrees Celsius and maximum will be around 28 degrees. Dehradun will witness thunder showers with strong gusty winds. Chandigarh will have generally cloudy sky with 1 or 2 spells of rain. The national capital Delhi will have generally cloudy sky with light rain. Mumbai will have partly cloudy sky. Chennai is expected to have thunderstorm with rain. Kolkata will have mainly clear sky. And in Hyderabad, it is likely to have thunderstorm towards evening or night.
And now an overview of today's newspapers. All dailies have reported about the Supreme Court asking the centre to present a national plan for oxygen, medicines, vaccines and lockdowns, taking so motor cognizance of the COVID crisis. Quoting the Apex Court, The Hindu says, "We expect national plan from centre on oxygen, drugs." All 18 plus can register from 28th April for vaccine jabs, reports the Asian Age. With stricter provisions invoked, a front page headline in the Economic Times writes, "No curbs on movement of oxygen vehicles." Quoting the centre, it says, "District administrations will be held responsible in case of any violation." The Indian Express, quoting the Finance Minister, writes, "Second wave will not affect big reform push." US drug major Pfizer says it will offer vaccine at not-for-profit price for India's immunization program, writes the Times of India. The dailies have also mentioned the launch of India-US Climate Agenda 2030 announced by the Prime Minister. And finally, NASA had logged another extraterrestrial first on its latest mission to Mars, converting carbon dioxide from Martian atmosphere into pure breathable oxygen, reports Hindustan Times.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi to chair high-level meetings today to review prevailing COVID-19 situation, to interact with chief ministers of high-burden states also. Finance Minister Nirmala Sitharaman asks insurance regulator IRDAI to ensure timely authorization for cashless treatment of corona patients. Uttar Pradesh government to invoke National Security Act against those responsible for black marketing and hoarding of necessary medicines and oxygen. Over 13 crore 53 lakh COVID-19 vaccine doses administered in the country so far. Election Commission bans roadshows, padyatras and vehicle rallies in West Bengal. Registration for annual Amarnath Yatra suspended temporarily amid rising COVID cases in the country. Prime Minister Narendra Modi announces India-US partnership on clean energy and climate change. Indian women boxers clinched 7 gold medals in World Youth Boxing Championships in Poland, and Royal Challengers Bangalore registers thumping 10-wicket win over Rajasthan Royals in IPL cricket. And with that, we end the morning news. Have a nice day.